video series. I'm your host, Matt Williams, and we're continuing our discussion with Dr. Tara Buck. So you had been telling me about how special training in autism can affect treatment. So tell us about some of the comprehensive psychiatric evaluations that you provide.
Yes, so all of our physicians at OU Tulsa spend at least 2 hours doing psychiatric evaluations with children and families. And I think this is really important because we want to take time to really understand the child's baseline functioning, their family, their environmental factors in school, and all that wonderful history that I think is really important in making a diagnosis and a treatment plan. So we spend quite a bit of time with our children and families, and I think it really helps us provide comprehensive treatment plans for the children so that we can advocate for their needs in school and in the community.
So a pediatrician, they do their developmental screenings. They may say, hey, you should go somewhere and get more of a extensive evaluation. Would that be when the family would come to you and get more of an intensive look at autism?
Many times kids are referred to our clinic. Sometimes parents will self-refer, but usually a child will be picked up by their primary care physician if there's a concern for a developmental delay, or many times what will happen is a child is already struggling with emotional or behavioral problems at home or at school, and so then the parents will seek out treatment for our evaluation.
But you're not just testing for autism, you're testing for a wider range of...
We do. So we do a comprehensive psychiatric review of systems. So we will review developmental history. Many times we will also use evaluations if a child's been seen by a psychologist previously. We'll review that information or any other pertinent clinical information. And then we really try to sort out what other co-occurring mental health issues or behavioral problems could be happening for that kid.
What do you often see in addition to autism with diagnosing?
So interestingly, children with autism are at a higher risk of developing other co-occurring mental health disorders. So for example, we see many children with autism spectrum disorder who also have ADHD symptoms, or they may have co-occurring anxiety that impacts their abilities in school or impacts their functioning at home or with their friends and in the community. So we really try to sort through what the core symptoms of autism are and then what the other co-occurring mental health disorders may be going on with a child.
I'd imagine that would affect treatment decisions if you know you have autism and OCD, for example.
Definitely. It can be challenging because there are no medications that treat the core symptoms of autism, and so we really want to provide effective treatments for a child. So if a child has autism and a co-occurring mental health disorder, we may recommend other types of therapies or maybe medicine to treat those co-occurring mental health conditions. So it's important for us to sort that out because we can't treat the developmental disability with a medicine. So
yeah, that's what I was going to ask, because there's no medicine to treat autism. So,
yeah.
But I know a big part of your practice and what people view you as in the community is medication management. So what are you oftentimes treating with those medication prescriptions?
So these co-occurring mental health disorders can be treated with medicine. We don't have a lot of medications that specifically are FDA approved for children with autism, but some studies will look at neurotypical kids with these mental health issues like anxiety disorders or depression or ADHD. And so many times children with autism can benefit from these medicines, but there are just some particular things we have to monitor closer because they may be at a higher risk of side effects or they may be more sensitive to the medicines.
Right. I can imagine when a lot of parents get that diagnosis that your child's autism, they want to turn and take a pill and medicate and treat some of those symptoms. What information is helpful for you as a doctor to know when a parent has questions about maybe what medications would be helpful? Like what data can they bring? What can they share with you that's helpful?
One thing that's very helpful is if parents will help explain how their child's behavior differs from their baseline functioning. That can be very helpful to better assess if there's environmental factors going on or if the child is developing some type of mental health disorder or even something medical going on. So really getting a sense of how things are differing from their baseline is helpful. Also, any information we can get from other individuals who work with the child, so a teacher or other providers, therapists, can be very helpful. Many times we use rating scales to help get additional information too. And if a parent can come with behavioral data from one of their therapists, that can be very helpful too, so we can really objectively look at how their behavior is changing over time, and look at specific measures of behaviors.
When you say different than baseline, you mean if something's out of the ordinary, the parent knows their child well, if this just isn't quite, in keeping with what they know of their history, that's when you would recommend they come and talk to the doctor.
Exactly.
Okay. And then let's say that maybe they've been prescribed medication and they're kind of seeing how that works. What questions should parents ask their doctor about kind of how things are going to look moving forward?
I think it's important for parents to have appropriate expectations as to what a medication can do and what it can't do. So again, no medicine is going to treat the core symptoms of autism, but maybe it can provide supports in regards to other things going on with that child. I think it's also important for parents to understand how long some of these medicines take to work. Some medicines work very quickly, while others can take several weeks to work. And so understanding that so you don't give up too quickly on a medicine can be very helpful. And all medicines have risks and benefits. So I think it's important for parents to understand what the potential benefits are, but also potential side effects, because kids with autism can be more vulnerable to side effects of medicines that neurotypical kids may not be. And so it's helpful to be able to watch for those things and to know when to talk to their doctor about a change.
What makes them more vulnerable to some of the side effects?
We don't fully understand why. We know there's differences in their brain development. And so, for example, when we treat ADHD symptoms in children with autism, they have a much higher risk of developing side effects to stimulant medications than neurotypical kids would. Now, they can still benefit, but the response rates are about 50% compared to up to 90% in neurotypical kids. So there are just some differences there when we compare kids with autism to other developing kids.
And as those children get older, do the effects and side effects change as they get older? Like things like puberty or getting maybe just bigger physically, do those types of things affect it much? Yeah,
it's very individualized to the person. So some people, as the child grows older and becomes an adolescent, they actually outgrow some of their symptoms. So that's one of the things we see in some kids with ADHD is their symptoms can actually get better as they get older and their brain matures. So they may not require medicine later in life, whereas maybe they required significant medicine when they were younger. So the brain is a very fascinating organ, and it just changes throughout development. And honestly, the brain isn't fully developed until a child is 25 years old. So there's quite a bit of range there that they may change over time in their development.
Well, that's all really great information. I appreciate you kind of walking me through it. Make sure you stay tuned for the rest of our conversation with Dr. Tara Buck.